Back pain. Back pain is an extremely common occurrence within the UK. It is reported that between 60 and 70% of the population in the UK will experience back pain at some time in their life. And when we get back pain, our back feels very tight, it feels very, very stiff, it can feel achy. Often I'm not able to stand up for any period of time and I'm not able to move and walk and bend. And what we feel that we need is actually for our back to be mobilized, or our back to be stretched, or our back to be rubbed in order to try to relax down the muscles. But even though that's what we feel that we might need, actually what the problem is not that our back is too tight and needs to be relaxed, but actually the problem is that our back is not tight enough. Now I know that seems a strange concept, because when you experience back pain, you actually feel that the best thing that you might have done to you is that you have your back relaxed and massaged, but really that's not going to help. And the reason for that is the back is tight because your brain and your nervous system want your back to be tight to protect you. And the reason why your brain wants your back to be tight to try to protect you is because it feels that it's not tight enough. And therein lies the rub. We need to get patients with back pain, their back stronger, and then the big muscles that they feel that are tight and achy then start to relax. A lot of the problems with back pain start with instability in the spine. So we have 139 joints in the spine, and each joint has to translate, so that's move just a little bit, a couple of millimeters, and it rotates just a couple of degrees. So it translates and rotates, and that happens much like a snake at every single level of the spine. And unfortunately what happens is that our spine becomes a little bit unstable. So the neurological control, the control of our brain controlling the little muscles in between the spine, doesn't actually provide really beautiful stability in between the joints. And so as a consequence, the joints become irritated and they become inflamed, and then my bigger back muscles just tighten everything up. And then you go and see your therapist and they try to relax the muscles down, which will work wonderfully well for a short period of time, but then of course the back muscles tighten up again, because the author of the problem is neurological instability caused by lack of control of the little muscles that are supposed to protect the spine. Now we're not saying that you need to go into the gym and do lots of exercises in the beginning to resolve this. That may come later. You just need to reacquire the brain muscle connection with the little muscles in between the spine.